Everybody knows about kids as they hit puberty, they get acne. And guys a whole lot more than girls because their testosterone levels just go crazy in puberty. Women do too. Young women, their testosterone level, that's what starts puberty in a girl. Testosterone will rise. That's why you'll have some acne in women. Women about 10 times less and 10 times less severe than guys. But let's talk about adult acne. I do hormonal therapy in my practice. I see lots of women who have very low testosterone levels from stress or ovarian failure or whatever, and we'll give them a little testosterone, and occasionally they'll get acne. They'll also come in with acne because they have polycystic ovaries or some kind of testosterone level that's elevated for another reason. So what do I do about acne? Well, in adults, it's not like kids. You don't need to go ballistic. You don't need to use big, strong drugs. Accutane is one of the drugs that's used. It causes liver problems and can cause emotional problems. In kids who have really bad acne, sometimes you need to use it. But my preference is to use vitamin A. Vitamin A is retinoic acid, and Accutane's isotretinoic acid. So it's very close. They're really molecular, they're very close compounds. But the vitamin A is totally safe. You don't have any of the same side effects, especially when it's water soluble. So I'll give 100 to 200,000 units of vitamin A for a week or so, and then cut the dose down real rapidly and keep them at about 20,000 after maybe a month or two. And that acts almost like Accutane. It's very, very strong, very, very effective. And I don't know if you know about those topical skin things that kids use. They'll put them on their zits on their face. In adults, you can use about a quarter of the strength. So instead of using a 10% benzoyl peroxide, you go all the way down to 2.5%. That's the medication side of it. You can also use a drug called spironolactone to block the production of testosterone in women. And then, of course, just good, gentle facial cleansing. Gentle, that's the whole thing, gentle. Some kids especially, they'll scrub their face because they hate the look of it. And adult women don't like the look of it either, but scrubbing does not get it done. Very gentle with your fingers, with just a little bit of cleanser. And you can get stuff over the counter that's good. Something natural, not a lot of chemicals is better. And then diet. There's a lot of talk that diet doesn't make any difference. I totally disagree. If you're eating junky food and lots of sugar, your immune system gets stirred up and it gets sick. And then acne is like a bacterial problem. That's why you have acne. And your immune system doesn't fight it well. So eating less junk, very low strength benzoyl peroxide, a vitamin A protocol, those kinds of things are all good for adult acne. And you just don't have to live with it. And don't put up with your doctor telling you that there's nothing you can do, because there is something you can do. And remind him that low strength benzoyl peroxide, vitamin A protocol, get with your doctor on it, make sure your hormones are good, always have your hormones tested, and get him in the loop, because we're better together.